My name is Jarod and I'm a physical therapist in the area. And I'm here to talk about, as you can see on your handouts there, how to do functional movement screens with your clients in order to identify things that may predispose them to some sort of injury. As Barton Creek trainers, and I've actually been here before with clients, I know it's a really high level of training here, so a lot of this is going to be probably some repetition and some preaching to the choir, but hopefully everyone will get something new and useful out of this. The thing that kind of got me thinking of doing this was that I probably see injuries from gym workouts, whether on their own or with a personal trainer, as much as anything else, aside from maybe athletic injuries, with football and things like that. So some of these injuries are obviously completely unavoidable, but I think that some with certain, screening and you can find those predisposing factors and keep them from happening in the first place. So, obviously with this kind of information, doing these screens is going to build, an immediate rapport and trust with your client. You can, point out, hey, when you're doing this, I see this happening. That could predispose you to this type of injury. So we're going to adjust things like this, get you strong, in that way, so you don't have to worry about that. So, and obviously, it's not all about money, but if you have a client that's injured, they're going to be spending, less time and money in here in the gym with you. So keeping that from happening is important for a number of reasons. So my background, I'm a doctor of physical therapy. I received my doctorate about 6 years ago in Florida at the University of St. Augustine, and I did undergrad at UT here in Austin. I was a student athlete there and injured most of my career, which definitely, compelled this career path and also doing things like this with injury, predispositions. I've done a lot of certified strength and conditioning stuff. I've done a lot of advanced training in manual therapy especially, so I'm a certified manual therapist too. And about 1.5 years ago, I started my own clinic just down Bee Caves. It's called Carter Physiotherapy. It's a little different than what you think of as most traditional physical therapy clinics. I spend a full hour one-on-one with each patient in each session, and the focus is really on hands-on manual therapy. I certainly teach them the strengthening and stretching things that they need to do on their own, but I don't have them doing a lot of that stuff in the clinic with me if they can reproduce it on their own time. And between what I do with my hands and that extended one-on-one time, I tend to get very fast results. I have a reputation of getting people back from injury a lot faster than average. This is not an exhaustive list. I tried to keep it brief. It's going to go a little ways, but it would take days to go through all the different things you could look at with any new or current client and figure out what exactly they're predisposed to. So like I said before, I'm going to focus on kind of the top 5 things that I think would help me identify or help you guys identify the things I see most commonly as injuries in my clinic. When we find these things, or when you find these things with your client, the vast majority of them, you're going to be able to take care of it in the gym with all the stuff you already know how to do. There'll be a few times when I do say, this is something that really should be referred out to a healthcare practitioner, but the majority of them can be taken care of here. Speaking of referring out to practitioners, I'm obviously a big fan of physical therapy. I hope you are too. But there are differences in treatment approach and clinic types out there. So when you're looking at referring clients out, there are a few things I think that are good to keep in mind. One, look for clinics and practitioners where the patients are not going to be, they're getting treatment with 2 or 3 other people at the same time. Where one-on-one care is either non-existent or very small. So you're looking for a place where there's a good amount of one-on-one care. They're not spending a ton of time, on modalities and exercises that they could do on their own time or with you guys here in the gym. And then I would definitely recommend finding someone who does know how to use their hand, who has some advanced manual therapy training, because in general the rehab times are going to be a lot faster. And it may sound funny, I just kind of described all the stuff about my clinic and myself, but actually here in Austin we're very lucky. There are a lot of great therapists here that fit those characteristics, not just me. So I'm not here to say just send me your patients. There are a lot of great guys and girls out there that do that stuff, but look for those things because obviously you want your clients going where they're going to get better the fastest, and I think that those are characteristics you should look for. Okay, so first thing, I see plenty of shoulder patients, and so the overhead reach, just to keep it simple, not checking every range of motion, but just having them go straight overhead in that kind of a 45-degree angle. And the first question is, how high can they go, for one? What's their range of motion like? Do they get any kind of an impingement or block along the way? Or maybe they have a pain in the middle and then it gets better at the top, which is called a painful arc. If they're dealing with any kind of pain, discomfort, a blocking, pinching feeling, or they can't get above about 150, 160 degrees, in those situations, I would really use caution with a lot of overhead presses or really, really strong, even below, below shoulder level, really, really strong forces, because quite often, especially in your patient population or your client population that's like middle-aged to later in life, when they have that impingement or that pain coming up, there's already some level of fraying or minor tears at the tendon, at the supraspinatus, the rotator cuff tendon. And so if they're repeatedly, even at light forces, pinching on that small tear, or if they do a big force, using that tendon, that small tear can become a big tear. And that's a really long rehab process after that surgery. So you want to definitely be careful with that. This is one of the few things we talk about where I'd say if this is going on, it should be referred out, simply because there's so many things that could be a part of that issue. It's not just necessarily the joint or the soft tissue or the scapular mechanics. There's just so many things that can contribute to that being a problem. That's one I would definitely send out to a good therapist. If it's appropriate and you can see how their shoulder blades move, you can get them to do it backwards and slowly lower down. And as they lower down, see if if their scapulas kind of come back into midline fairly symmetrically. What you might see sometimes if there's an issue with the way the scapular muscles are working is that they'll have some scapular winging or kind of pop out or move differently. And if you see that, there's a dysfunction present. And there's a lot, I'm sure you guys know about shoulder stability exercises and scapular mechanics. So if that's all that's going on, they have good range of motion, decent strength, no pain, don't need to send that one out. Just get that scapula moving right. So the next thing is abdominal strength testing. And I'm just going to say something that you're probably not going to like to hear right at first, but I love P90X. Not at all because of what it does for patients or not because of any results that someone gets or doesn't get, but simply because it's created a lot of low back pain patients for me. It's made me a lot of money. And I wish I was joking, it really has, I'm not kidding. And I've been meaning to send them a thank you card or something, but I haven't gotten to it. But the problem is that on that program, and in a lot of gyms, I see people trying to do abdominal exercises or being asked to do abdominal exercises that their abs are simply not strong enough to actually do with good form. Because the hip flexors love to get involved in abdominal exercises, especially the psoas. And so on an anatomical level, what happens, especially with abdominal exercises like leg lifts or planks is a good example. The psoas runs from the inside, kind of upper hip, and attaches to the lumbar spine at all segments. So it's not just a hip flexor in that it pulls the hip up, but it pulls from the other direction too, right? So if it's pulling from the lumbar spine, what it does is it'll pull you kind of down and into an anterior pelvic tilt or a low back arch. And so what happens is that if they're repeatedly getting pulled in that position, into that position, it's compressing all the structures in the low back, and then they end up with pain. Now, if you have abdominals that are strong enough to counteract that, create that posterior pelvic tilt, and you keep a neutral spine, then you're fine, and they're fine. But what I've seen is that a lot of people are doing exercises without that abdominal strength. So I like to do this particular strength test you guys might already use, I'm not sure. Could I have someone maybe to help me demonstrate? Lay down on your back here. And I'll just throw out here too that there was an article in JOSPT in 2002 that looked at this actual test, and it didn't discredit this test. The test is still good, but it discredited the way that it was used in terms of a grading system. And I don't think a lot of people saw that article, so I'll explain a little bit more. But basically, even people with verifiably strong abs, when they start to lower their legs down, there's going to be at least a little bit of an anterior pelvic tilt. The strongest of people are going to tilt a little bit. So when you do this test, and I'm guessing you've all probably seen this and maybe use it. You know, when I say, you know, squeeze down on my hand here, and then I'm going to have her lowering, just wait for a sec, I'll have her lowering her legs down. I don't stop the test at the first hint of any kind of pressure coming off my hand. What I look to see is, can they sustain a really solid pressure? And I stop the test when I start to see that the legs, the back is lifting up at kind of a 1-to-1 proportion with the legs, right? Because usually they'll have a little tilt in the beginning, and if they're strong, they can hold it a good bit further, right? So let's go ahead and try it. So you want to do a lot of cueing to continue to press, squish your hand. So go ahead and bring your legs straight up. Knees is good hamstring flexibility. So squeeze down in my hand. And technically, they want you to cross your arms across your chest. Okay? So keep this pressure here and slowly lower down your legs. I'm not helping her. Okay, slow, low, 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 and stop there. Okay, so go ahead and come down. So that's not bad, actually, about a 45 degree. I mean, she's doing pretty well. But there was that initial liftoff, and so just keep that in mind when you're looking at your patients. If you immediately feel that lift and then it continues to really lift off your hands, then they are truly, you know, dealing with some weak abs. And you know, this isn't probably the most repeatable between people, but if you try to replicate it the same way yourself each time, you can get a good idea of how your clients are progressing with that. Thank you very much. Yeah. So a couple more things. And I also repeat those a couple times. Sometimes the first effort's great, and then you see that they actually have very little endurance. Other times I find that the first effort isn't so good, but once they've done it once, it's like their neurological system's turned on a little bit and the muscles are firing better, and they improve in the second and third test. So I usually run that a few times. A couple more things on ab exercises. With planks, I wrote on the thing, it says using abs or glutes. See a lot of people using planks, a lot of good trainers, making sure that the spine stays neutral and all that. But what I don't see a lot of are them checking, are they counteracting the hip flexor pull and keeping neutral spine because their glutes are doing that, or because their abs are doing it? Now, if you want the glutes involved, of course it doesn't matter. But if you want it to really be a solid ab exercise, and specifically for the abs, what I do is I'm right there on the ground with them, and I'll palpate on the glutes themselves, right? And I'll say, you know, I want you to really relax these and use your abs to keep your back flat. And I kind of draw in like this. Maybe, sorry, I shouldn't have had you sit down, just do a quick. So go ahead and get in the front plank. So I'll say, you know, so I'm drawing in on the abs here, kind of give that, so go ahead and flatten out the back, lift up a little bit, and keep these as relaxed as you can. And she does pretty well with that. It's a little bit more of an art than I'd like, but no, you're fine. But I just wanted to show that if you really want the plank to be as solidly about the abs as possible, make sure they're not getting too involved with the glutes.